Okay, today's topic is pancreas. The objective for understanding are introduction and feature of pancreas, parts of pancreas, neurovascular structure of the pancreas, histology, development and clinical significance of pancreas. So, pancreas is elongated accessory digestive gland which is situated on the posterior wall of the abdomen. It lies in the epigastric region, umbilical region and left hypochondric region. These are the 9 quadrants of abdomen which were discussed in previous videos. It has two parts, endocrine and exocrine. Exocrine secretion, that is pancreatic juice, flows of digestive system enzyme into the second part of the duodenum. Where the main pancreatic duct and the accessory pancreatic duct secretes their secretions into the second part of the duodenum, which helps in digestion of lipid, carbohydrate and protein. And also it has endocrine activity. The endocrine secretions like glucagon, insulin and somatostatin, which secreted directly into the bloodstream, helps mainly in maintaining the glucose homeostasis. Now if you see the shape of the pancreas, it is mainly J-shape or retort shape. All of the retort represent the head of the pancreas. This part are neck, body and the tail of the pancreas. So here if we are talking about the measurements of the pancreas, these are like length about 12 to 15 cm, its width is about 3 to 4 cm and its thickness is about 1.5 to 2 cm. Weight about 80 to 90 grams. Now the pancreas is divided into various parts for the better understanding. So here first is head portion, second is neck, then body and the communicating part is tail. These are the 4 parts of the pancreas. Now we will discuss about the head of the pancreas. It is elongated disc shaped, flattened at the right end of the pancreas and it lies at the concavity of the C-shaped loop of the duodenum at the level of L2 vertebrae. Now what are the external features of this head portion? The head of the pancreas having 3 borders, which is superior border, inferior border and the lateral border. Also it has 2 surfaces, anterior surfaces, another one is posterior surface. So it has 3 borders, 2 surfaces, as well as it has a process known as uncinate process. It is projection hook-like process from the lower and left part of the head. Now the superior border is related with the first part of the duodenum and the superior pancreatic duodenal artery. Now next is the inferior border, which is related with the third part of the duodenum and also the inferior pancreatic duodenal artery. Next is wide border, that is the lateral border, which is related with the second part of the duodenum and also the anastomotical channels between the 2 pancreatic duodenal arteries. Now next we will discuss about the surfaces. Anterior surface. It's related with the following structures from the above to below. First is the first part of the duodenum. Next is transverse colon, root of the transverse mesocolon and jejunum. Now next is the posterior surface of the head of the pancreas. The posterior surface is related to the inferior vena cava, left renal vein, bile duct, as well as the right crus of the diaphragm. Next you see the head of the uncinate process, which is projected from the head of the pancreas, is mainly related to the anterior with the superior mesenteric vessels and posteriorly to the abdominal aorta. So this is what you need to know about the relations of the head of the pancreas to the adjacent organ. Now from the neck we will continue in the next lecture. Follow for more.